In this video, we are going to discuss when can an IVF treatment fail. So failure of IVF treatment is because of two major factors and few minor factors. The major factors being the quality of the embryo and the lining of the uterus called the endometrium. So now coming to the quality of the embryo, which depends on the quality of the egg and the quality of the sperm used in the IVF cycle. So egg count can be compromised, or egg quality can be compromised in certain patients like endometriosis, poor ovarian reserve, PCOS, or advanced age women of more than 35 years of age, or those women who have previously undergone cancer treatment. A poor sperm count can be found in patients who have abnormal lifestyle like obesity, excessive intake of alcohol, smoking, tobacco, or lack of exercise, or if there is lack of sleep. So if the sperm and the egg quality is compromised, you will definitely get a compromised embryo and it can fail your IVF treatment. Other than these, there are certain genetic conditions which can get transferred to the embryo and the IVF can fail. Coming to the next factor, which is the lining of the uterus called the endometrium. The inner lining of the uterus, which is shed in every menstrual cycle, is very important for the implantation of the embryo. There are certain infections like pelvic or genital tuberculosis, chlamydia infection, pelvic inflammatory disease, where this inner lining of uterus is usually hampered, and this leads to the failure of IVF. There are certain conditions in the fallopian tube like hydrosalpinx or pyosalpinx, where there is deposition of or collection of infective material in the fallopian tubes. This infectious material can be toxic to the embryos and hence result in failure of a IVF cycle. There are certain minor factors which are also very important in the success of IVF. These are the condition of the laboratory where the embryos are being formed. If there is a poor condition of the laboratory, then your IVF can fail. The skill of the embryologist and the andrologist, and the embryo transfer technique, and the skill of your doctor or clinician. Thank you.